Hello, and welcome to this short animation aimed at helping understand what family therapy is, who can benefit from the approach, how family therapy has evolved over time, and contemporary practice. So what is family therapy? Family therapy is a way of thinking and working with whoever it is we are seeing. It's a framework for practice in the same way that, for example, cognitive behaviour therapy or art therapy are frameworks for practice. This means that a family therapy approach is about how we think and work, not who is in the room or how many people are in the room. This addresses a common myth about family therapy, that the approach is only for families. Family therapy is absolutely for families. And also, it's an effective way of helping that is much more broadly applicable. Family therapy can assist individuals, couples, families of any constellation, including young people living in residential care. It's also helpful with teams and stakeholder groups, and can be a framework for professional and clinical supervision. Family therapy involves a shift in focus. A great metaphor is to think of a camera. We are widening the lens so that we can consider what is happening for the individual and also within their relationships and the broader context of a person's life, and how relationships and context influence the way people and families make meaning of the things that happen to them in life and the things they might be seeking help with. So what are the broader contextual considerations that a family therapist might be interested in? It might be helpful to think of a person as belonging to ever-widening circles of context, including their family, work, hobbies, sport, friends, community, religion, spirituality, and even more broadly, or if you like, the bigger circles that spread out from a person, considerations of gender, socioeconomic status, culture, and even the era in time a person has grown up in. Some people call this a person's cohort. And so, in effect, we are taking a helicopter up to look at the big picture and consider the person, their relationships, and their context. This helps identify possibilities for where we might land the helicopter, with landing referring to the type of therapy intervention that might be most helpful and acceptable to the person, couple, or family. So how did family therapy get started? You can think of family therapy as a tree that has grown over time, with the foundations being the roots of the tree, and those roots being systems theory. Systems theory started to develop around the 1940s, and it was a revolution in thinking that placed the spotlight on social context and interaction in order to understand human behaviour, especially in couple and family dynamics. This was a major shift from the dominant approaches at the time. Systems theory is an exciting combination of ideas from diverse fields that might not typically be associated with helping professions, and also ideas now taken for granted. In the early days, family therapists were very interested in behavioural patterns, communication, and the structure of family systems. We call these approaches the first generation. As time passed, family therapy was influenced by changes in the world, leading to the second generation approaches. And currently, we are in what some people describe as a third generation, with evidence-based practice, integration in therapies, including ideas from neuroscience, and the application of family therapy ideas to specific issues, including trauma. If you're getting curious about what was happening in the world that influenced the development of family therapy, you might be interested to think of the 1970s and 80s as a period of time described as the winds of change. Feminism helped family therapy consider gender and power. Postmodern thinking and a social constructionist perspective help family therapy move beyond behaviour to consider meaning making. And whilst in the early days the changes in knowledge helped with the evolution of family therapy, there were also some conflicts and tensions as merits of different understandings and knowledges were explored. To understand the different approaches or schools of family therapy that have developed over time, it might be helpful to think of these different approaches as different applications of systems theory, or if you like, different ways of travelling a family therapy road. And so each of these approaches has something in common: the family as a system. And depending on where in the world you were as family therapy evolved, you might use different terms: family therapy, systemic psychotherapy, systemic family therapy. Some people prefer the term systemic family therapy because of the focus on systemic thinking. Today we would say the defining parameters are relationships, context, and meaning making, which consider interaction, interrelatedness, and circularity, and how each of these are influenced by context. Family therapy is also very interested in our clients' perspectives of problems and solutions, and their resources, competencies, and strengths. And so today, you can think about family therapy as a smorgasbord of ideas and ways of helping others that all rest on a table of systems theory. And you can develop an individualised plate from the smorgasbord for each person or family you are working with. You might even like to add something to the plate from a different approach to therapy. Thank you for taking the time to watch this animation, exploring the question, what is family therapy? If you would like to find out more about family therapy and options for professional development or the Certificate in Systemic Family Therapy, please visit the Queensland Institute of Family Therapy website. Thank you.